HAI was created in 1968 primarily to provide access to live music for institutionalized individuals. Today, HAI is a multifaceted agency providing a wide range of arts, education, and wellness programming. Our services reach people in challenging life situations such as advanced age, illness, and disability, as well as disengaged youth from urban communities. HAI's founding director, Michael John Spencer, was a struggling concert pianist and student at Mannes College of Music. Research for his graduate thesis led him to the Manhattan State Psychiatric Center. This was a time when patients were warehoused in the back wards, think Shutter Island or One Flew Over the Cuckoo's Nest. In walks Michael, with his long hair and portable piano. The orderlies set him up in the service elevator of this facility and he begins to play. He plays and plays and plays Bach, Rachmaninoff, Prokofiev for the captive audiences of the New York City psych wards. And then a miraculous thing began to happen. The recitals turned out to be mutually beneficial. The ward's attendants reported a decrease in disruptive behaviors, and meanwhile Michael got sincere artistic fulfillment. So Michael decided to push the envelope a little further. He then began taking the patients out of the wards and over to Carnegie Hall, Lincoln Center, Broadway, anywhere he could get a ticket. Government agencies and health professionals began to take notice, and this expanded into what is today Hospital Audiences, Inc., or HAI. In 2011, HAI was one of a handful of New York City arts organizations invited to participate in a Kennedy Center Bloomberg Philanthropy Symposium aimed at supporting local arts leaders. It has proved invaluable to HAI in defining what we do and how we define success as an organization. For example, we learned what HAI really needs is to differentiate itself in how we position ourselves in relation to other arts services agencies, in how we communicate what HAI does, and in how we connect our family of supporters to our program participants. We also recognize the need for us to diversify our income streams. As a result, one of our primary objectives currently is to incubate new social ventures. Since HAI first brought mental consumers out of institutions and to Carnegie Hall in 1968, we have sent thousands of people to Broadway shows, museums, and other cultural events. Along the way, we've built relationships with numerous local arts and cultural institutions. Seizing on this resource, HAI plans to launch a new online venture this coming year, Tickets to Go. The online service will enable the general public to purchase tickets to Broadway and other arts events at HAI's discounted prices. A portion of the proceeds from each sale will support HAI's mission and general operating budget. HAI's value lies in the breadth of our services and our vast network of affiliate arts and healthcare organizations. Although there are other organizations in New York that offer specific arts programs or recreational services, nobody has our history and depth. Ticketing, transport, visual art, theater, concerts, we do it all. HAI is an umbrella for artistic experiences as well as arts accessibility. Our sheer size enables HAI to quickly and seamlessly integrate new enterprises to accommodate shifts in demographics and approaches to healthy living. Let me give you an example. HAI buses have been transporting mobility-impaired passengers to arts events all across the city since the mid-'80s. In 2011, nutrition advocates and the New York City Council launched a pioneering nutrition program to promote healthy living for the growing population of seniors. A component of this endeavor was to transport groups of seniors to farmers markets and other healthy living venues. HAI was immediately able to respond. We had relationships with senior centers, we had the buses ready to roll. Today, HAI is not only transporting seniors to the market, we are complementing the trips with a visit to the museum or a concert on the bus. This is just one example of how HAI can adapt. HAI is effective because we are responsive to the needs of those we serve. Whether it's a single consumer, an agency partner, or a private funder, We see ourselves as accountable to each of them. So how do we do this? At large community performances, HAI conducts audience surveys to gather feedback on the quality of the programming, the accessibility of the space, and the affordability of the ticket price. And when HAI artists perform on-site at local facilities and in schools, our independent monitors are there. The monitors report back to us on the impact of the performance, the professionalism of the artist, and the client's response. These mechanisms help HAI to continually improve its existing services and to develop future programming. And when it comes to our arts education programs, we use measurable outcomes. In our after-school program serving at-risk youth, we track attendance improvement and credit recovery. One education partner reported 70% of students in their HAI Arts Enrichment Program had increased their entire grade point average by 3 points or half a letter grade. In all, the system of checks, balances, rechecks, and rebalances stabilizes HAI and makes it effective. The most common misperception about HAI lies in our name, Hospital Audiences Incorporated. Although we are proud of our rich history, the moniker hospital audiences can be confusing for people. It implies that we only work with hospitals, and it doesn't fully articulate the diversity of our services. We do work with hospitals, but we're also involved with students, seniors, veterans, and anyone who otherwise doesn't have access to the arts and culture of New York City. From its inception, HAI has been seen as a leader in the field of arts and disability. Our innovative programs have caught the attention of presidents, governors, and mayors alike. The National Endowment for the Arts bestowed their prestigious Best Practices in the Arts in Healthcare Award to HAI's Outsider Art Studio. The program attracts special needs adults with artistic abilities from around the city. They come weekly to our loft in Soho to create art and to have quality social interactions. The work these artists create is often exhibited in the HAI Gallery, which itself is internationally renowned for producing prominent artists in the Art Brut movement. One such artist, Melvin Way, has been celebrated with exhibitions in London and Paris. For those of us that know him, it's remarkable to think his journey began in the late 1980s at a homeless shelter on Ward's Island. HAI's work blurs the lines between traditional arts programming and health and wellness services. This, combined with the fact that we primarily deal with marginalized individuals from urban communities, presents a considerable challenge for us. There isn't a groundswell of support or public discourse around arts access as there is for education reform. Closer to home, we've seen a sharp increase in the privatization of public spaces around New York City. Communities have rallied to ensure arts programming in greener spaces, but there's been no outcry over what the lack of access to public space means for individuals with disabilities. With additional funding, HAI would accelerate its use of technology to further promote accessible art. We are actively researching digital opportunities to increase outreach, diversify fundraising efforts, and further our mission. One example of this initiative is a project to create a custom-designed smartphone application based on our Access for All databases. Access for All is HAI's information database for people with disabilities who wish to attend cultural venues in New York City. By creating an Access for All smartphone app, HAI will be developing a modern tool to help thousands of disabled New Yorkers and tourists. Ultimately, the goal is to treat technology as a bridge to the arts. HAI would like to provide more resources to Alzheimer's patients, as well as to seniors opting for home care as opposed to nursing homes or hospice. We will all age, and we are all aging. So how does HAI best assist this growing population of elderly New Yorkers to do so in a humane, dignified, and creative way? We believe that this question is at the heart of future HAI programming.